Good Saturday morning to you, and welcome to The Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. Very, very, very informative this morning. And by the way, if you've missed any of our previous shows, or maybe you can only catch some of this one, you can always check out theburlingtondentist.com, where there's I guess you could probably watch these shows on demand. I don't want you to miss anything. Or if you join the show maybe halfway through our tenure, I always recommend just kind of going back into the library a little bit and watching some of the older shows. If you'd like to schedule yourself a consultation, or maybe somebody you know, a kid, you know, your son, your daughter, your grandchild, clue mom and dad into this, of course. Send an email over to drbrennerradio@gmail.com. drbrennerradio@gmail.com. Brenner is Brenner. If you're like me and you like to do things the old-fashioned way, pick up the telly. 860-673-7155. Again, the number is 860-673-7155. And I will repeat those points of contact at least a couple more times before this show is over. Good morning. Great to see you.
Good morning to you.
How's your week? No, don't answer. Don't answer. I'm gonna channel into you.
We had a pretty big blizzard there.
I am going to channel into you, and I know what your answer is going to be, because it's the same answer every week.
It is.
Busy.
Yeah.
Yeah.
Well, people have problems. And I do more than just sleep anyway.
Well, you're a dentist. Yeah, exactly. You do teeth.
Yeah.
Do you have a habit of, like, when you meet somebody for the first time, do you look at their teeth?
Yeah.
You have to, right?
Yeah.
It's like a hairstylist not looking at your...
And if you go to the restaurant, I look at all the waitresses' teeth because I can tell who's been and who hasn't, who's got dentures. My kids used to, Mom, does she have a crown on that front tooth? Yeah, she has a crown,
I have seen some people over the last maybe couple of years where, look, we all want to have white teeth. And the toothpaste that I use, it's with whitening, but I've never had my teeth whitened, ever.
Okay.
I see some, I think they can glow in the dark. It's like it's overdone. It's too obvious.
Yeah. We call that paper white.
It'd be seeing somebody who's like somebody 90 years old with jet black hair. It's like, come on.
Right. Right. Well, it became a big fad in the 90s.
To do the whitening?
Oh, yeah. Yeah. So you have to remember...
Is that good for your teeth?
It's not all bad. Depends on what system that you're using. So there's whitening and then there's bleaching. And
I thought they were one of the same.
That gets into a whole other subject matter, which is what we're not going to do today. But
give me a 20-second answer. What's the difference between a whitening and a bleaching?
One actually penetrates into the tooth and whitens it more deeply.
Okay.
And the other is like a surface stain.
I see. There you go. Good stuff.
So, yeah.
All right.
So whitening's not bad if it's done right. And two, the toothpaste, they charge you a lot of money and it doesn't do much.
No.
Just saying. You spend a lot of money on it.
Yeah.
Do you remember the product Plax? Do you remember that PLAX?
Was that something you swished in your mouth? Yes.
Right, remember that?
They don't have that anymore,
billions on consumer ignorance. Billions. It does better than brushing alone. Well, yeah, anything you can swish with water and it'll do the same thing.
They're not around anymore, are they?
They sold it.
And then DeBuyer just closed.
It doesn't work. Well, they put out some of the competition. I think Procter & Gamble, I think that makes Listerine. I think they're the ones that bought it.
Oh, right.
They took away their competition.
Yeah, because they were not billing themselves as...
remember all the car manufacturers? They bought up all the electric cars in the 70s. Do you remember that?
Vaguely.
Yeah. Anybody that was developing an electric car, they bought up all those patents, and then they used our gasoline cars. They didn't want the competition.
Who's the guy that owns Amazon? Is that Bezos?
Bezos,
okay.
yeah.
If anybody was trying to do something very similar, that's what he would do. He would just buy him up.
Yeah.
Crush him.
Well, anyway.
Must be nice. I thought we might start with let's talk about the 5 key areas to sleep.
Yeah.
Yeah. What do we know here?
Well, number 1 would be breathing, right? Which I think is kind of essential, right?
Key. Yes.
Well,
key is the magic word.
So we've talked about breathing in other shows. And so I'm going to touch on this in a slightly different way here. Why is breathing so important, right? So we want to do what we call belly breathing, where you take a deep breath from the gut, You're going to fill up. Notice how and you can't see it on the air, but I'm straightening my body.
Yes,
Right? To
I
take
did
that
see it. I
deep
noticed
breath,
that.
okay? So you want to not be so schlumpy, and you want to take a deep breath. Do we do that? No, we sit over, we kind of lean over and like shallow.
When did we become
shallow
such a
breathing.
lazy society?
I don't know. Anyway, but I can remember my grandmother used to say, sit up straight, right?
Yeah.
And we'd sit up
It was
straight.
generational. Yeah, I heard
Right,
that too.
exactly. So posture is important with that. But here's the other side. We've talked about what yoga does, right? Breathing through yoga, breathing through Tai Chi, breathing with other, like Wim Hof, and we've talked about the Buteyko breathing styles. What does that do? So why is breathing so essential? Breathing actually calms our system down. So we talk about sympathetic and parasympathetic. We've done this for many weeks.
Mm-hmm.
You don't want to be in sympathetic. You want to be in parasympathetic. And breathing drives us over to parasympathetic. And why is that? Because it's going to decrease that sympathetic arousal. What pushes us up into sympathetic is shallow breathing. And that's why sleep apnea becomes important, because that's a different kind of breathing, and we're actually holding our breath. We're stressing the system. We're not taking those deep breaths. We really are shallow breathing while we're sleeping. So then when it stops you breathing, that's what sleep apnea is, right? There's a pause in the
I
breathing.
got that. Yep.
Okay? So then our system goes on alert, right? The alarm systems start going off, right? The alarm bells. So that's why breathing is essential, right? We do need to do that, otherwise we die. And then it's also how we breathe. All right? So that's a key component. The second one that we want to talk about, because these are the 5 pillars, right, is inflammation. But inflammation can come in lots of different ways, right? So that's why we're going to touch on that a little bit. Inflammation, you think, oh, it's such a simple thing. Well, when you get a paper cut, right, you think, that's a pretty tiny, but it hurts when you press on it, right? That's inflammation. The body goes, oh, there's something wrong over there, and I got to go fix it. Well, it takes a couple of days for that to go away, right?
Yeah.
Okay.
Absolutely.
But it eventually goes away.
Of course. You hope.
Okay?
I mean,
right.
you heal.
But some inflammation doesn't go away, and people get sick. So what do they get sick with? They get sick with things like lupus, like arthritis, like gout, like...
Oh, my goodness.
Right. We call those are the sympathetic or autoimmune diseases. We're making ourselves sick. We're not catching a bug. It's not like catching a cold or a flu. It's not cancer. It's not diabetes. But they could be on the list if the inflammation stays too long in the body. Okay? So what do people do to try to get over inflammation?
Well, they take medicine, right?
Well, some do. Some take vitamins.
Yeah,
Right?
okay.
So you say, okay, I'm depleted of vitamin C. I
Sure.
need some vitamin C. All right, got that.
Makes perfect sense.
Right? But not everybody does that. And 2, it's how we eat that helps us get over that inflammation. So once food heals yourself. So Aristotle was right. How many hundreds and thousands of years ago was he, right? So he was like, use the food to heal yourself, because they knew eons ago. And if you look at a lot of cultures, fasting was important in those cultures.
Intermittently or like days on end without eating?
No. We're talking about it's a religious thing, right? They were following certain protocols. It would be you fast during Lent, you fast during whatever your religion is, all right? So is it Ramadan that they fast? I think they fast in Ramadan. I don't know enough about all of them, but I know that there's part of all the cultures. There's a fasting component to it. Mm-hmm. So why is that? Because people felt better. When I get people to fast, and I'm not talking days on end, I'm saying try a 2-day fast, right?
Don't eat for 2 days.
Well, you don't eat certain things for 2 days, and you drink. You're going to have water, you can have coffee, you can have tea, you can have bone broth. Okay, you can have certain things that will give nutrients to yourself. You don't want to have nothing for 2 days. But you want to figure out what it is that you need to do, because I akin this to what I explain to patients is when you've got a big traffic jam on the highway and you can't get off the highway, well, that's your food that can't get into your liver to get to the nutrients to the body. Okay, so you got a traffic jam. You keep snacking. You're eating a little bit all the time. You snack at breakfast. You snack a couple hours later. You snack when your stomach grumbles. You eat a lunch. Oh, and another. Oh, you're going through the kitchen and you're going to grab an apple. You're going to grab some grapes. You're going to eat a piece of cheese. Not a good thing to do. So you're creating this traffic jam into the liver. And the liver's our detox center. It's also what disperses our nutrients to the body, okay? Because everything has to go through the liver. It's got to get checked before it puts it in your blood, right? So if you jam up the system by the way you eat, okay, you create some issues. So that's where fasting clears the highway. Like like the blizzard we had this week, right? It cleared the highways because there was nobody on the highway, right? So when your body goes into that, guess what happens? If you're in it enough hours, and usually it's right around 16, 18 hours into the fast, you start to feel better. And your body does this thing called autophagy. So it goes around and it goes, how efficient are you, cell? That you're in my gut lining, or you're in my muscle, or you're a blood vessel thing, right? Maybe it's a blood cell, right? Are you doing your job? How well are you? Are you being efficient? If you're not being too efficient, put up your hands. Okay, you get to die. Okay? And we sort of go through and do a self-check. You're just going to go along and say, we're going to clear out all the dead weight, right? We're going to clear out all the stuff. That's why, if you remember back watching The Biggest Loser, do you remember watching that? My mother was a big fan of
My mom was a big fan of that show, too.
I didn't watch it a whole lot.
That's about losing weight, right?
That was about losing weight.
Yeah.
So these guys were very overweight, right? And they would cut their calories and they're starving, but then they'd work them out and they'd make them miserable, getting on the treadmills and lifting weights and doing all this stuff, right? What happened to their skin?
It sagged.
Big, flabby
That's
stuff,
right.
So when you do autophagy and you eat a certain way, which we can talk about in a little bit, when you eat a certain way, the body will take care of all of that stuff and it eats it up for you. You don't end up with sags of flesh. You can lose a lot of weight pretty quickly, and your body will be in this autophagy to kind of clean up all of that. You won't have these big looping sags of skin all over your place, right? Do you understand what I'm saying?
I do.
Okay.
I do.
So there's what autophagy does. And autophagy is very important. It also cleans out all the viruses out of your cells. It also cleans up some of the cancer stuff. So it sort of does, I'm going to say, your self-check. Okay? But people, like my brother, goes, I can't fast. I can't do that. I'm going to die if I fast. And I'm like, yeah, well.
2 days, really?
So you can do something called intermittent fasting. Okay? And
I've heard.
And we can get into that. So this is why inflammation matters, okay? Now we want to have a balance of all the systems.
I think I want to fast. I want to go on a 2-day fast.
Well, they're easy to do, but you don't start with a 2-day fast. You start with doing it a little bit, right? So maybe you do
the intermittent.
You start with a 16-hour fast, okay? Then you have a 6-hour eating window, okay? That's the kind of thing that we want to do.
I like that.
All right.
It's a plan.
So now we want to balance all the systems. And when we balance stuff, the body's already been trying to do compensation when we end up with inflammation. It tries to adapt. Like if you're overeating, it's like, okay, she's feeding me a lot. And I'm like, okay, where do I put this now, right? So we'll store that over in this fat cell. We'll store this toxin over in that fat cell. We have to clear it out of the blood if we're on a pre-diabetic situation, because the physicians won't even tell you you're a pre-diabetic until you're a diabetic, and they can give you medication. So from 90 on your blood sugar to 200, they don't tell you a thing. But you're doing damage to the body all that time. That part upsets me, because I would think that they say things like you should lose weight. Okay? What does that mean to people? I tried a diet and I'm not successful with my diet. Well, now we've come out with the GLP-1s, so we won't even get into that. But my point is that there's ways to do this that are successful. They're very doable. And so some of the people that I've talked to, and they're not even clients of mine, right? They're just like my reps that pop in here and there, might be neighbors, friends of mine, and they'll say, well, how do I do this? And I'm saying, this is how you do it. Well, one guy's already lost 45 pounds.
Wow.
Yeah. So this is why inflammation matters. All of that stuff that we're storing, fat cells create inflammation. And in the adaptation part, we screw up our hormones. which causes us to gain more weight. Okay, so it's a catch-22 when we start going down that avenue. So when I talk to people, I need to start to pull them out of that sympathetic mode and pull them into parasympathetic mode. Okay, so what we want to do is to start looking at how is the face functioning, right? So I'm a dentist. I've got to look at their joints, their teeth, their airway, and I need to then start to look at how is that all functioning together. Are you crunchy when you open and close? Some people hear that crunchy sound. Some people pop and click all the time. Well, when I was in dental school, they said, well, if it doesn't cause them any pain, it's okay. Well, you don't need to treat it right then and there, but it's coming, okay? Because the popping is really a symptom of ligament laxity. So what does that mean? The ligaments are overstretched already.
They're loose.
So think about a knee, or, we have these knee braces, right? So we don't overstretch because we've torqued our knee and now we've got a little problem. Ankles are a big one, especially in sports. We wear ankle supports, right? Because you roll your ankle over. That's an overstretched ligament. So what can I do to your face? I can't put a big wrap around your face. You got to eat and chew and talk.
Right.
So what do I do with your face? I don't do too much, okay? I can't stop the ligament laxity there. Okay, does that make sense to you?
Yeah, perfect.
Okay.
Yeah, where you don't have, there's no face brace, right?
Right. Well, they've made some. You're going to wear it all day long?
No.
I'm not. No. So that's kind of the practical side of this, right? So how do we work with that? So you want to look at how are we making any joint sounds? So the clicking is a symptom of ligament laxity. And it's coming, you're going to start to do damage. It's at the area where you're going to get inflammation, you're going to get arthritis. So when I check people, and I have we call it a Doppler, so I can put this little hearing thing on your joint when you open and close, and we can hear how crunchy you are. And you can hear it as the patient. It's like, what are the sounds in there? Are you making these sounds when you chew, open and close, move your jaw side to side, front to back, right? So if you're making these sounds, I'm going to tell you right now, those are not good. So as a patient, and if the dentist goes, well, if it doesn't hurt, don't worry about it. Well, that's not true. Okay. All right.
Let me do something really quick. Folks, you are listening to The Sleep Show along with Dr. Bethaney Brenner. I'm Gary Byron. You can check her out online at theburlingtondentist.com because she is a dentist. If you want to give a call, you can do that as well. You can schedule a consultation, 860-673-7155, 860-673-7155. Please continue.
Okay, so then the fourth thing that we need to talk about is stress, because everybody comes in and tells me how stressed, and that's what's causing them to grind and clench their teeth. Okay, well,
is there any truth in that?
Sure.
Okay,
but here's the thing. What's going on, okay? What's happening when you do that grinding and clenching? So we're starting to have what we call a movement disorder, okay? So the stressors actually signal sympathetic tendency. What does that mean? So when we get ourselves grinding and clenching, that means you're probably right over there in sympathetic. Okay, this has been going on for a while. Now, stressors, as we all know, can come and go, right? You can be stressed on your job. You can have an argument with your spouse. You can not sleep well one night. That's a stressor. Okay, what are you worrying about, right? You can have a death in the family. You can have a divorce. You can have kids that are sick and you're up and down all night long. Those are stressors. We all get them. That's called life, right? But what can we do to mitigate those, right? And this is where, when I see people who are in constant stress, when you're grinding and clenching so much, we're setting ourselves up for what we call a permanent neurological pathway.
Or a heart attack.
We can have heart attacks. But so now we want to look at how's the whole system adapting, because that's an adaptation to the stress that we're grinding our teeth. And usually when we're grinding our teeth and we're wearing our teeth down, I'm starting to look at airway issues. I'm looking at inflammation, those first two pillars that we're talking about. I'm going back and I'm saying, okay, how many symptoms do you have that should drive me to say maybe we should have a sleep test looked at here, okay? So we're going to do a home sleep test, or what we call an HST. These are things that'll then help us to say, do you have something deeper going on? Now, we can get sleep apnea as children, as young as 3 years old. We can have them, and obviously into our 80s and 90s, and I do that for a wide range of people. So, and what drives people into my office is usually a problem. So think about that, right? What problem do you have? And this is why we're talking about this. So stressors in grinding your teeth is just a symptom, but is it a symptom of something deeper going on?
Sure.
Okay?
Yep.
And then we want to look at the whole body. What happens to people? Because they get injuries. They can have PTSD. We can have environmental toxins that we've been exposed to. We can have an injury like whiplash, a punch to the face. And the interesting thing is that the body adapts, and it may take a year for them to have a symptom, like whiplash. Whiplash takes a whole year before you start to develop a jaw problem.
I didn't know that. I thought it was pretty instant, yeah.
It's not. Unless you get hit by something, okay? So if you have, like, something that strikes you, right? But whiplash is typically I'm sitting in the car and that stops suddenly, or someone runs into the back of me and I go, flung, flung, you're flinging yourself forward and backwards. That's a whiplash. But what if you got hit by part of the car? What if the bashes into you? See, there's a difference in that kind of injury. So some injuries take a while, and people who get socked in the chin, they think, oh, that's where that problem is, right? It's the tip of the chin. But you just jammed both your condyles of your jaw into your skull, right? Now, did you get a concussion when that happened? Okay, so these are so we have to start to look at the whole body. So I ask people, how many surgeries have they had? What kind of injuries have they had? Did they fall off their bicycle and hit the ground when they were a kid? And I deal with those too. But oftentimes, the whole picture, I have to look at the whole picture. Like I said, I feel like I'm Sherlock Holmes someday. I got to look at all of this stuff and put it together, and then to say, do you have enough symptoms that we should consider a home sleep test? That makes sense?
It does. I didn't realize how complex it is.
Yes, it's a very complex thing. And not only that, but we have people that treat it in bits and pieces. So dentists who are sleep trained are trained to give you one type of appliance, okay, which is what we call a mandibular advancement device, okay? So I'm sort of a little more different than that. I believe that we can also do epigenetic orthodontic treatment. What does that mean? It means that I can help open up your breathing. I can help put your face in a better position. So we tend to see the sleep apnea drop way down. And I think I've talked about this one lady. She was the most dramatic because she was, I think, 68 on her sleep test, which is how many apneic events she had per hour. Once I opened her up, we did some epigenetic stuff with her. We also then made her an appliance. She changed what she was eating. There was a whole lot of stuff going on with her all at the same time. Wow. So she has 1 to 2 episodes an hour. Okay. She got off the CPAP because I had to put her on a CPAP while we were fixing her because I'm like, I don't need you to die while we're doing this. Okay. But she's a happy lady. She has no more pain. She's breathing fine. But there were a lot of things that were going on. So those are the tough ones. Okay. So some people, it takes me a lot longer. Some people, it's pretty straightforward. Okay, we've got a little arthritic condition in the jaw joint. We can use a few things. Some people are eating pretty good, but not perfectly. I can make an appliance that's appropriate to get the joint in a proper position, and then their pain goes away. So how do we do all of this? Which appliance is most appropriate? And there's so many patented appliances. We get our favorites, of course, but it's not the same for everybody.
That's good to hear. It's not one size fits all here.
Exactly. So they're customized.
Wow.
Yeah. So for somebody who's 78 years old, who's getting pain now when she's chewing and crunchy sounds when she's opening and closing, I found out that she had a wheat allergy. Okay. She didn't know it, but her sister had one. And she goes, my sister's a celiac. And I said, oh, really? Maybe you have a tendency in that direction. Maybe we should give up gluten for a little while and see if their inflammation reduces. And we can test that. Blood tests will tell us how your inflammation is doing. And interestingly, she did that. She did that on her own. I suggested that she consider it. She went and vacationed with her sister, went to visit her during the winter. Like, thank goodness she went to Texas instead of Connecticut that year. But she came back and she goes, I learned all this stuff from my sister, so I'm buying different food. I'm eating a different way. And all the pain in her face went away.
All thanks to you and what you did for her.
Well, once again, it's figuring it out, right? It's not the same for every single person.
All the more reason to get tested.
Well, if it's appropriate to test you. I have some people come in and it's a tooth problem. They have an abscessed tooth.
But you can help them with that as well.
Well, yeah, I can. But so I have to be smart about my investigation. What symptoms do they have? Well, we're talking about sleep here, so of course that's the primary concern that we're talking about today. But I had a lady that came in and she had all this face pain and she had some signs of sleep apnea. She had mild sleep apnea, but she also had 3 abscessed teeth. So that was really what was driving her face pain.
I say this all the time. It's bizarre how it's all interconnected.
Yeah. And so you can't be one-dimensional. It's not one size fits all, right?
That's what I was saying, yeah.
And so you have to look at this as a bigger picture. And the neurological component of this, which is where I go back to how the body adapts, because it changes your hormones. It changes, we have parts of our brain that can get shrunk up. That's a better way to say it. It doesn't stay fully.
As you age, you're saying.
Yeah.
All right.
Yeah.
Look at that. The five key areas of sleep, or as you call them, the pillars.
There are pillars. Yeah.
That's how we talked about them individually. I love how you tied them all into this morning. Folks, if you'd like more information on this or any of the other topics that we have covered on this show, head on over to theburlingtondentist.com. If you find yourself where you're maybe nodding your head going, oh my goodness, some of this sounds familiar, you know what? Why don't you just sit down and speak with Dr. Bethaney Brenner? I think you'd get a lot out of your consultation. You can do that by calling 860-673-7155. Once again, it's 860-673-7155, or you can zip her an email to drbrennerradio@gmail.com. Brenner, Brenner. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next Saturday morning, have a good one, everybody. So long.